Thank you. Well, that's very nice. Well, as I stated in the chat, I came home yesterday from a weekend off the grid, and I found Theo's messages because I thought the event was later this month. So I prepared yesterday evening for you a presentation quickly, and I used Jamboard, because this is very simple and I use it for workshops, and it's a favorite tool for me. So there's a simple presentation for you, and I'm going to share it in a minute, and I hope you like the presentation. So I will tell you about using patient journeys to improve healthcare in 3 ways. But first, you might want to know something about me. I have been working in healthcare since 2014, and then I started as head of communications and digital strategy at the Amsterdam University Medical Center until 2018, when I founded Patient Journey Lab, and I have been working for a few other companies since then, or organizations, healthcare organizations, such as the Dutch Association of General Practitioners. I worked at their thuisarts. I told about this project on the conference last year. And then I worked for Kanker.nl, which is a cancer information platform for patients, and at the moment for Nier.nl, which is kidneys, also for patients, and at Maastad Hospital and dental clinics. Now you can use patient journey mapping in 3 ways. You can use it to improve your marketing and communications, which is the most used way actually, because it started there, improving the service, improving the marketing communication in commercial organizations. And you can use it to do process improvements, which is very complex in healthcare, but it really helps if you map journeys and you use empathy in the process. And you can use it to do innovation. And I mean, not only find innovations, but also create something for the innovation. Now, I would like to give you some examples. Of course, you can improve your marketing by mapping the patient journey. Some call it micro journeys. I prefer calling it sub journeys for your website or your application or even a chatbot. And you can also use it to find the moments in the journey where the patient needs the information, because in a lot of times the timing of the information is key, because people are stressed, emotional, and they forget a lot. It's always found that they forget half of the consult with the doctor. So I can give you an example where a hospital could change the communication to improve the experience of parents. There was this, if people get an appendicitis, if children get an appendicitis, it's often an acute and sudden operation. And the surgeon says to the parents, well, the surgery will take an hour. And after an hour, I will tell you what happens. But then the process is an hour and a half. So after an hour, the patient parents get stressed. And they think, oh, something must be wrong because we didn't hear from the surgeon. Well, actually, before and after the procedure, there is a lot of things that has to be done. So if you map the journey, you will find out what causes the stress and causes the parents not to have the right information at the right time. Now, process improvement is another way to use patient journeys. And process improvement in an organization is always complex. And as in healthcare, the processes are often created around scarce means, or expensive people, and the process is seldomly created around the patient. So if you map the journey and you interview patients and you present these results in a workshop with the people involved, there is often kind of an aha moment where they think, oh, this is what the patient feels. I can give you an example of Jonas. Jonas has plasticity, which is created when he was started when he was born, and because of it, his hip is disconnected. So the disconnection of the hip, and he needed throughout his younger years a Botox treatment. But he can only call, the hospital says he can call when he needs it. But then after he calls, there's a period before there's time available to give the treatment. So Jonas is always in pain between the moment he calls, because he can only call when he needs it. This is stressed by the doctor. And when you map the journey, you find out that this period in which he is in pain is much longer than the hospital would want it to be. So this will create base and support for changing the process. Another example I came about, I found we did a journey in an outpatient department where people were brought, where people arrive by taxi, or a next of kin brings them, and they have to wait in the waiting room until they are admitted to the doctor. And the volunteers in this organization said, sometimes we want to help people to go to the toilet, but we're not allowed because we're not trained. And these people have to sit and wait until they are admitted to the doctor before somebody can help them go to the toilet. So this is found out, so they can create a way to help these people in between. It's really simple, but it's something found out during patient journey mapping. You can also use patient journey mapping for innovation. I can give you an example for a hospital. They asked the innovation department, we want to implement using a video during the rounds in the morning when the doctors are around the bed of the patient of the geriatric department, and then they wanted to call somebody in the family or a caretaker to give the information, because a lot of time there was a lot of stress around the moment the patient was discharged. But we interviewed patients and nurses, and we found out the stress was not about this moment or the information given at that moment. The stress was in the process, because sometimes a surgeon would say, oh, I'm going to find out if you can be discharged tomorrow. You might be discharged tomorrow. And the patient would think, oh, I can go tomorrow. But there was a miscommunication, because the surgeon didn't explain it in the right way. So in this situation, the nurses decided they wanted to take charge over the communication process before the innovation would be implemented, because the innovation wasn't the whole solution. Then I would like to give you another example. I was at Hacking Healthcare in the Netherlands 2 years ago, and there was a group of young professionals who wanted to, they were of different profession. One of them was a doctor. They worked together to find out an innovation, and they started mapping the patient journey of one of their friends who was in the group. And this friend had cystic fibrosis. He had this, and they found out his biggest problem in his journey was the moment he wasn't at home. He was, like in Hacking Healthcare, with a group of friends. And during this day, he would not take his medicine, because the vaporizing of the medicine would sometimes take 20 minutes or even more. And he wouldn't be bothered at the moment. But it was medication needed for him. So he invented this machine, they called it at the moment the Nespresso for his medication, to vaporize it, and they won the prize. So as an example, I would also like to give you the app we created at the Amsterdam Medical Center for the neonatology department. This was there were two nurses. They had this grant to create an app for the communication towards the parents of the newborns. And the newborns, this is of course a very stressful situation for the parents, because they think we will become parents in a few months, and suddenly the child is there, and it is taken into the hospital. So you can imagine the stress at the moment. And they had this really big pile of information they would give to the parents, and they knew it was too much. And they also wanted to share photographs with the parents. And they had a grant, and we mapped the journey, not only with the nurses, not only with after having interviewed the parents, but also with the ICT department and the department for the electronic health record, because it was assumed we needed the information from the electronic health record to create the app. And we found out it wasn't needed at the moment immediately, because the information, medical information, or the personal information actually needed for the app could also be put in by the parents. So the link wasn't necessary, and it was small bits of information, it wasn't really a lot of work. And we also found out we needed two apps, one for the nurses to give the information to the parents, because they needed a good user experience, and the other was for the parents to manage, for instance, photographs if they wanted to share it with their family. And while mapping the patient journey, we found out at which moment the information of the big pile could be given. So there are a few pointers or rules which I can give you when you start using patient journey mapping in healthcare. So always start with the purpose of the journey, because the purpose influences what questions you ask a patient and who needs to be involved. So I came upon a situation where the journey was already mapped, and then you might find out the questions are not addressed at the contact points of the patient with the organization involved, but for the journey in general. And you might have missed information about what device somebody would prefer, what way the information should go to the patient. So always start with the purpose. And the journey is not the goal, because crazy or not, you see that if there's a trend of patient journey mapping, sometimes organizations just start and say, well, we would like to map the journey without deciding what the purpose is. Then always involve those whoever has patient contact. So, for instance, the example of the volunteers, not a lot of organizations would have thought, well, we want to include the volunteers in mapping the patient journey. And in this situation, it was a very crucial moment for the patient in the journey. And nobody, neither the nurses nor the doctors, would have known this. And then another important rule is, after step one follows. This is a change management rule, actually. And it means that if you create a journey and you have a certain goal, you always look at the journey with fresh eyes and say, is this the right goal? Like in the example with the hospital with geriatric patients, we found out the goal was innovation, and we found out process improvement was needed also before we could implement innovation. and then use journey mapping to decide. And this is also from this way. Maybe you know the value irritation model. If you don't know it, look it up. It was created by one of the founders of Amazon, and this is a way to map, to use the patient journey and the journey of the people in the organization to prioritize and find out how the process can be improved and how the communication improved. So Google value irritation model, and you might implement that. There's one thing you should have in mind. Value irritation model in commercial organization is often used to make costs cut. So make it cheaper to help your customers. While if you use it in healthcare, you should look at how can I improve the emotions, how can I improve the journey, and because it will influence the way the patient feel, and it will might in the end influence their healing process. So this is all I would like to tell you about patient journey mapping. And now there's time for questions. And I would like to share the Jamboard with you. And you can, so we can all map the questions and see what comes out of this. So if you have a moment, I'll type it in. One moment. I can share the link with you, and then we can all work together in this Jamboard. And I'll send you the presentation in the end. Let's see. Can you go into the Jamboard?
I think you, Ilonka.
Yes, hello, Theo.
Yeah, I see the Jamboard's on there.
I see an anonymous user, and some people already joined the Jamboard. So I typed value irritation model, which is the model I told you about, which was created by the Amazon founder. So please ask the question in the chat, and I can answer them in the Jamboard.
I think.
Do you have questions?
Yeah, Rebecca's got a question there. She's saying she didn't catch the model name.
Yes, I put it already, put it in the Jamboard. But I'll put it here.
Ladies and gentlemen, we can open the panel up. So if there's anybody that's got any questions for Ilonka on a presentation, thank you very much, Ilonka. Yeah, so we'll leave it open for a couple of minutes. So if anybody has any questions, we're just going to keep it out as long as possible for everyone.
The question is, how do I handle this complexity? Well, it's all about making the choices up front. And there's another thing you really want to do is use personas. Because using personas will lessen the complexity, because you can, it also helps you with the empathy. So you can place yourself in the perspective of the persona, and you can make choices from the perspectives of the persona. And then in design thinking, there's a rule, design for the average and test with the extreme cases. So if, for instance, you create a website, you design for a persona, which is the average. And then when you do the testing of the prototypes or the other steps ahead in the journey, you can find, you need to find people who are, for instance, very high or very stressed or very have problems reading. Is that a good answer for you?
I'm assuming so. Ladies and gentlemen, there's actually a section at the bottom of your screen. You can see there's Ask a Question. So if you did have a question, you're most welcome to ask it there, and people can vote for the question. Or you could just ask a random question as well. Yeah, so
it's more the journey can have many steps in it. So you want to know how many steps a journey can have. So you choose the steps depending on the interviews. So and it really takes a bit of practice, but you choose the steps which have the most stress. So for instance, and you use this, it's a lot of like being in a waiting room or having the conversation. So every step is a moment for the patient in the journey. I'm starting now to make a template with UXpressia. UXpressia is a tool used to map patient journeys. And we're making a template, and in a few, I think in a month, this will be available in UXpressia. But you can also use this tool because there are a lot of examples in it. So choose, I will type, choose the steps.
call. And what is the tool called?
I put it in, I'll put it again. But this is a tool. There are other tools. Some people use Miro. There's a template in Miro. But what I like about UXpressia is that you can add videos or illustration. You also have Snappy. This is another tool. But Snappy is a bit more expensive, so that's why I always recommend UXpressia, because you can also share a journey with someone else if you have a prescription, and the other person can adjust the journey, and that's very easy. So do you have any other questions?
Okay. Thank you very much, Ilonka.
Okay, well, have a nice day, and I hope to check in later today.